Okay, thank you and good afternoon, everybody. I hope everybody in the area has had a little bit of a break this weekend. I'm not going to take much of your time today, so let me jump into the updates for the region. This is where we stand today, 2 weeks to the day since we started these briefings. So here are the numbers as of today. And again, these are all the task force hospitals in the St. Louis metropolitan area. So as of today, we have 683 hospitalizations, which is about the same as yesterday where we had 684. We continue to remain up 50% from where we started, though, about 2 weeks ago. There are 176 intensive care unit patients, which is about the same as yesterday where we had 173. We have 136 patients on ventilators today, which is down slightly from 144 yesterday. And of course, the good news is we have 49 COVID patients that were discharged yesterday, so always good news. Again, just to reiterate this graph, in the past few weeks, we've made some really important progress in stopping the spread of the virus. As you can see, the cases are starting to flatten there. But it continues to put hundreds and hundreds of people in our region in the hospital. And again, as you can see from the slope of the curve, we've increased 50% from when we began reporting just 2 weeks ago. So this is a remarkably contagious virus, so the steps that we have taken have absolutely had an effect. Staying at home, washing our hands, keeping surfaces clean, and practicing social distancing while we work to stop the spread. And so as I say, on just about all of the daily briefings, stopping the spread decreases infections, it decreases patients, and decreases death. And so very much appreciate all of the efforts that everyone in the community is doing to help the community as well as the healthcare workers. And so with that, I'm going to stop my comments and address some questions from the media.
You previously said the peak in the St. Louis region should arrive around April 23rd to 25th. What's the current projection date? Has anything changed concerning that projection?
The current projection date remains the same. In looking at the number of cases that we have and comparing them to our model, we're pretty confident in our model because of the match between the slopes and the number of cases. And so we're still fairly confident that that date range will be between the 23rd and the 25th.
What's currently working in handling the pandemic locally and what's not working?
There's a couple of ways of thinking about that. So anything that we can do to decrease spread is, of course, helping to work. So on the community side, of course, all of the shelter in place and social distancing and hand washing are all having an effect on decreasing the number of cases. On the clinical side, I would say we're learning a lot from places like New York, Seattle, some of the things in the published literature. Some people may have heard of a paper that's going to be coming out about some antiviral treatment. And so all of those things have improved care within the hospitals. So it's a combination of things, taking those public policy measures to decrease transmission and also improving our medical care to improve survival from the disease as well.
Tracing is a big part of combating the coronavirus pandemic. What trends do you see when it comes to tracing in our area?
So tracing is a big part of the public health armamentarium for battling contagious disease. And so the health departments are the traditional partners in healthcare that do most of the tracing, if not all of the tracing. And so as you can imagine, with the number of cases increasing, it puts a strain on public health resources. For now, they're doing well, but again, we're always concerned if there are an increased number of cases, how can we handle that caseload? And you've also heard me talk about if we want to start decreasing or relaxing those social distancing measures, we have to have that robust testing and tracing strategy as well. And so we're working with our partners in public health to make sure that we have adequate staff and support, and then looking at some technologies as well to help support tracing.
When looking at the latest data, what's the most surprising thing you're noticing?
The most surprising thing I would say, and maybe it's not surprising, maybe it was, it was a good surprise, was when we were looking at the data early on, so 2 weeks ago, and watching the slope of the number of cases, we were, and I mentioned this on Wednesday, we were on that worst case trajectory, and then the cases made that sort of sudden right-hand turn to put us back on the expected trajectory, and so. And if you march those dates back, there's good evidence that says those social distancing measures, the shelter-in-place rules, were really what impacted that turn. And so that was a very pleasant surprise. But again, we always are skeptical of the way these curves work. And so it's certainly no cause to celebrate just yet. We're still leery of the number of cases that are out there, and so we need to continue what we're doing.
What's most concerning about the data?
Um, I think really what's concerning about the data, at least for me, is anticipating what will happen when we do have to start relaxing some of the social isolation and the shelter-in-place rules, and so. It's really looking forward is more what concerns me than looking at the present data. As I said, when you're looking at forecasting for the hurricane, you kind of know where the hurricane is, but you don't know where it's going, especially far out in the future. And so those are the things that I'm concerned about the most is what are we going to look like once we do start decreasing all of those social distancing rules.
Do you think the stay-at-home orders should go beyond May?
Difficult question to answer. I think we have to keep looking at the data, look at the trends, see which way they're heading, look at our new case counts, look at our new hospitalization counts, and have some confidence that we're improving as a community and decreasing spread before we can really come to that decision.
Looking at the local county case number breakdown charts, it appears the mortality rates for St. Clair and Monroe counties in the Metro East are higher than the statewide and Metro average. Why is that?
That is really a denominator issue, and it's not just for those counties, it's really for the entire country. Nobody really knows what the case fatality rate is, so it's the number of people that have the disease, and so if you're assuming that all of the people that have disease got tested, that's a different question than the number that actually got tested. And the second, there was a good story in the New York Times about that today. And the second part of that is once you start getting into smaller numbers, so a lot of those counties have very small numbers, that rate can fluctuate tremendously just based on the number of deaths and the number of testing. So as you can imagine, if you've only tested 2 people and one person ends up dying, that's a fatality rate of 50%, which is probably not accurate. It gets very unstable when you start looking at smaller numbers.
Similar question concerning Franklin County on the Missouri side, where they were actually talking about possibly opening up parts of their economy next week. Any comments about Franklin County?
No specific comments for Franklin County. I'm always cautious about taking those steps to decrease social isolation and the distancing and things like that. The virus is still out there. It's still circulating in the community. And we haven't developed a substantial number of immune people in the community. So we still have a sizable number of people in our population that are susceptible. And so I don't think that we should equate decreasing number of cases with the virus being gone. It's still there, and we still have a sizable number in the population that can be affected by the virus. So we just have to be very cautious.
This reporter writes that she just saw there are lots of new cases reported in Illinois. She's wondering where St. Louis is on the curve, in your opinion, and also do we have any breakdowns of data by race?
Do not have data by race yet. We're working on that, and so we're collating data between all of the healthcare systems, and we believe that we'll have that fairly shortly. The other part about the number of cases increasing, again, it's a difficult number to interpret. And the reason for that is the limitation in testing. So in any given day, it's really dependent upon the number of tests that we can do and the amount of testing that we can do in the population. And so frankly, for us, a better barometer is the number of hospitalizations than a number that are tested positive, because the number that are hospitalized is a true marker of people that have tested positive and that were sick enough to come into the hospital. And so that's really a much better indicator of the disease burden in the community.
Thank you. That concludes the list of questions received from members of the media prior to and during this briefing. There will not be a live stream briefing tomorrow. We will resume those Monday afternoon. We'll accept questions from members of the media for that afternoon briefing on Monday, starting Monday morning. Thank you for tuning in.